I wanted to speak to you about bone mineral density. I wanted to review your most recent bone mineral density. Osteoporosis or bone thinning was noted. Treatment is recommended. Medications are recommended to both improve the bone mineral density and lower the potential for a future fracture from osteoporosis. Now, we used a method called the DEXA scan. This is established standard for measuring bone density. It is performed by passing low-energy X-rays through a bone, most often in the lower spine and hips. It will indicate whether a person has normal bone density, low bone mass, or osteoporosis. Now, the DEXA includes two scores, a T-score and a Z-score. The T-score compares a person's bone mass with the young adults of the same gender. According to the National Osteoporosis Foundation, the scores fall into the following categories. Greater than -1 standard deviation was normal. From -1 to -2.5, that's low bone mass called osteopenia, a potential precursor to a condition called osteoporosis. Less than 2.5 is typically indicates osteoporosis, and your numbers were greater than this. Osteoporosis means porous bones. It's a condition that causes bones to gradually thin and weaken, leaving them susceptible to fractures. About 2 million fractures occur each year due to osteoporosis. Although all bones can be affected by the disease, the bones of the spine, hip, and wrist are most likely to break. Although the exact cause of osteoporosis is unknown, the process by which bone becomes porous is well understood. Early in life, bone is broken down and replaced continuously, a process known as bone remodeling. Bone mass usually peaks in a person's mid to late 20s. Recommended medications for osteoporosis to improve bone mineral density and lessen fracture rates include the following: bisphosphonates, RANKL ligand inhibitor, parathyroid hormone analogs, and sclerostin inhibitor. Bisphosphonates are anti-resorptive treatments and are usually used in the prevention of postmenopausal osteoporosis. They can prevent fractures in patients at moderate or high fracture risk and prevent bone loss for men and women taking steroids like prednisone. They work by slowing the cells that break down the bone, allowing cells that build bone more time to work and reduce the imbalance. Actonel and Fosmex are two brands that have been approved by the FDA for treatment. Available bisphosphonates are listed on the next. There is good long-term safety data for bisphosphonates with any medication, but there are also side effects. The most common side effects include muscle aches, joint aches, stomach upset, or heartburn. There are some rare side effects that have been associated with long-term use of bisphosphonates. These include osteonecrosis of the jaw and atypical femur fracture. Here is a list that I alluded to of available bisphosphonates right now. I should add that one of them is an IV infusion called Reclass, which is given one time per year and once every 2 years. There's also RANKL ligand inhibitor. This is called Prolia. It's the brand name of a prescription drug whose active ingredient is denosumide. It is used to treat osteoporosis in women who have already gone through menopause and have a high risk of breaking their bones. It's a group of drugs known as RANKL ligand inhibitors, which prevent certain proteins in the body from breaking down bones. It is available as an injection given under skin every 6 months. Common side effects include pain in your back, joint pain, weakness, acid reflux, symptoms of bladder or kidney infection, swelling in the feet, rash, and stomach pain. Serious side effects include allergic reactions, low red blood counts, life-threatening infections, bladder infection, breakdown of bone in the jaw that can be painful. Very rare side effects include urinary tract infection, pancreas inflammation. The next group of drugs is called the parathyroid hormone analogs. This includes Tymlos and Forteo, or a parathyroid hormone helps prevent low calcium by acting on the bones, intestines, and kidneys. In the bones, the hormone triggers the release of calcium stores from the bones to the blood. Tymlos is a man-made form of parathyroid hormone that exists naturally in the body. It increases bone mineral density and bone strength, which may prevent fractures. It is used to treat osteoporosis in postmenopausal women who have a high risk of bone fracture. It's given once a day. Use the medicine at the same time each day. The other parathyroid hormone analog is Forteo. It is a form of parathyroid hormone that helps stimulate bone formation. It is approved for use in postmenopausal women and men at high risk of osteoporotic fracture. It is approved for the treatment of glucocorticoid-induced osteoporosis. It's given as a daily injection under skin and can be used up to 2 years. If you happen to have radiation treatment or your parathyroid levels are already too high, you may not be able to take this drug. Then there is the sclerostin inhibitor. This is Evenity. It's a sclerostin inhibitor. Sclerostin is a it suppresses bone formation. It's indicated for the treatment of osteoporosis in postmental women at the high risk of fracture, defined as a history of osteoporotic fracture or multiple risk factors for fractures, or patients who failed or are intolerant to other available osteoporosis therapy. One dose consists of 2 injections, one immediately following the other, given once a month by a healthcare professional. It's discontinued after 1 year of treatment. Thank you.